Thank you, Mr. Chairman. I appreciate what Senator Tuberville said, and Senator Duckworth just alluded to this, that it is very difficult for the veteran to get their records. And I think one of the things we should look at is who owns those records. It would be so much more helpful if the veteran himself controlled those records. If individually we owned our healthcare records, every one of us, and then that way you wouldn't have the problem that you're talking about, Ms. Mathis. The veteran would be in charge of their records and would be able to take it, whether they're in community care, whether they're in TRICARE, because we have seen just an inordinate amount of waste in trying to build the electronic health records, whether it is Cerner, Epic, Oracle. It is like they can't figure this out. In Nashville, Tennessee, we've got a lot of health IT innovators, so they can figure this out. And one way to do it is to let individuals, not the doctor, not the insurance company, not an agency, own their health care records. I also want to say I find it very sad that for many of our vets, Tunnel to Towers and Wounded Warrior are the people that can help them get help, because the VA can't figure out how to do their job. They're still working remote. They do not show up. It takes forever. That's why there are 956,000 claims in the queue and nearly 300,000 over 120 days, and veterans cannot get a response from these people. I know a lot of it is because of the union that is there at the VA that is stifling access to this care and benefits. And I find it just something that should not be tolerated, and it's frustrating to the veterans that we're trying to serve. And it's why community care is so vitally important. And Ms. Marg, thank you for speaking to that. Mr. Golnick, I want to come to you and thank you for your service. And thank you for what you're doing with Forge and trying to solve a problem, because the VA has thrown up barriers to health care. And you're trying to get around that and improve access. So I want you to give like a 1, 2, 3 point. What could this committee require the VA to do to improve that access?
Thank you, Senator. And just to be clear, I am a co-founder of Forge. I've stepped down from full-time with them, so I'm representing myself. But
yes.
But I will say there are things, and to your point, Senator, I think there's a lot of friction points that are preventing veterans from getting access to care, especially when you're talking about mental health, right? I think what this committee could do is work with the VA to ensure that they're educating veterans, that the VA is educating veterans on what their options are. Number 2 would be the administrative side of this, ensure that the access standards are codified so people that within VA system know, okay, if X, then Y, right? I think that's as simple as that. And then I think ensuring that there's some oversight on certain VAs and certain VISNs in terms of that care making sure that care, the veteran is the true North Star. It's not what their local budget is. It's not anything else. Care of veterans should be the true North Star of all care decisions.
I agree with that, and putting the veteran at the center. That's why I've got this VA Healthcare Freedom Act that would remove those obstacles and really put the criteria in the Mission Act for eligibility for community care and give full choice to veterans in select regions. Let's roll this out as a pilot project and then put it on a 4-year path to fully implement it, so a veteran can go get what they need, when they need it, where they need it, show their VA card, and the VA gets the bill, not the veteran. And that would solve this and this enormous backlog that we have. Give the veteran the choice put them at the center of this. Thank you, Mr. Chairman.
Senator Blackburn, thank you. Senator King.
Thank you, Mr. Chairman. In answer to Senator Chobelville's questions, I think the beginning of this electronic medical records problem started with a no-bid contract.